adventitia. Adventitia. You have the innermost layer called intima. So these are the three layers in our blood vessels walls. The amount of smooth muscles differs from place to place. Well, as you go to the arteries, some of the layers called adventitia are not there; they are not found, and the arteries, as you find them in the tissues, some of the arteries are very porous, like there are pores here. There are pores. For example, the blood vessels in GIT, in our stomachs, in our intestine, the blood vessels are very porous and they allow lot of molecules. And in the liver, they are very, very porous, and in the brain, they are tight. The blood vessels cannot allow. They allow only small molecules. These are the things that they can allow. Now, the blood vessels are innervated by both sympathetic and parasympathetic. So the vessel diameter is determined by sympathetic discharge and the tone of the blood vessels. And this sympathetic discharge constrict the blood vessels, and the parasympathetic discharge dilate the blood vessels. And the flow in the blood vessels is usually laminar, and it is turbulent when there is constriction. So that is why there are sounds in blood diseases. So the flow is measured by a lot of procedures. You measure the flow. Flow is defined as the effective perfusion pressure divided by the peripheral resistance, and you get that number. It will correspond to the flow in a magnetic field. So when you come to high pressure, blood pressure, there are factors affecting blood pressure. The blood pressure increases as age increases. It is not a disease of a certain races, as they say that it affects black more than white. That's not true. The blood pressure increases as age increases. It differs from person to person. They are saying the normal blood pressure is 120 to 80 millimeters of mercury, and this is the average blood pressure. It differs from person to person. The blood pressure of some people, this blood pressure for some people can be a high blood pressure, and for